Okay, and we are live. So, welcome everybody to tonight's Combined Neighborhood Watch and the new reinvention of our Amazing Citizen Award. I am Master Police Officer Julia Cole. I will be our MC for the evening. So, to kick it off, I would like to recognize our distinguished guests tonight. So, those from Town Council, Miss Jamie Schmidt, Mr. Piranhas, our Town Manager, Chris Hively, our Mayor, as well as Mr. Joe Short and Ms. Megan Taylor, who is also hiding one of our representatives from our dispatch center, Mr. Moylan. Hello. He makes sure that we get where we need to go and that we keep informed on the radio. And again, thank you all for coming out tonight. I'm going to turn it over to Chief Settle.
Thank you. Thank you for everybody for coming tonight. We had an interesting day today. I will tell you, it started off this morning. Our first Chris Jenkins Amazing Citizen Award honorees, David and Joanne Durr, had unforeseen circumstances, no fault of their own, and could not be here tonight. So we will honor them May 18th at the next Neighborhood Watch meeting. So we are thinking about them, and nothing terrible, but they couldn't be here for unforeseen circumstances. So having said that, we were going to go over the history, the brief, untold history. If you wasn't at the Chief's retirement party, Chief Jenkins' retirement party, the brief, untold history of the Chris Jenkins Amazing Citizen Award. So we were planning on doing that, but he's going to highlight the show a little bit more than we thought tonight because he's going to be our stand-in, which is good. It's a good job for him. Now he's got all his time. He can be a good stand-in for anything. He's got a lot of time on his hands. Based upon the Chris Jenkins Amazing Citizen Award, we actually unveiled this at his retirement party on the beginning of March, and we unveiled it, and we actually presented him with the first ever Chris Jenkins Amazing Citizen Award, and it was such an honor to rename this award. And I'll tell you how it came about. And I told this story at the retirement party. Now we're on live TV, though, so I want to tell it again so everybody, all the viewers at home and all the viewers here that weren't at the retirement party can understand. So we go out to pretty much most afternoons. We just go take a ride at the afternoon, and we go to Dunkin' Donuts, and we ride around town. And that's when we come up with all our lame brain ideas, usually. He comes up with more than I did. And one day he said, I think we're in the Dunkin' Donuts drive-through line when this all came about. He goes, you know what? I'm going to create an award. And it's going to be an amazing award. And I think I'm going to call it the Amazing Citizen Award. And I said, well, that's pretty original. And he said, I'm going to name it because a lot of people in our community do amazing things and do great things and never get recognized for it. But they don't do it to be recognized. They just do it to help their community, and that's the type of people they are. And that's who we want to recognize. And I said, let's do it. So he gave his orders, and we made it happen. And we gave the first Amazing Citizen Award probably a month or 2 months after that at our neighborhood watch meeting. So that was the creation of the Amazing Citizen Award. As chief, I would probably do it less a disservice to continue the Amazing Citizen Award without giving credit where credit is due. So this is the first neighborhood watch meeting that we are naming the Amazing Citizen Award, the Chris Jenkins Amazing Citizen Award. So that will be forever lasting, and it will be here forever. Hopefully after we're all gone, it'll still be the Chris Jenkins Amazing Citizen Award, some sooner than others. So it'll be everlasting, and it's much deserved for the really over 50 years of public service that he gave, when obviously without seeking any credit or service or any honor or any rewards for such service. So without having said all that, we do want to represent him. We presented him this plaque on his retirement party, but a lot of you weren't there, and our viewers at home didn't see it. So I'll ask our new captain who is serving as our Deputy Chief of Police, Tim Chilton, to come up and help present the award. Only reason he's got glasses on and I don't. Yeah. So we're going to ask the Chief to come up, and we're going to represent him his award. Come on up.
They have a little dust on it.
I read it once, so I'll let the captain read it the second time.
So it says, with great honor, we present Chris R. Jenkins with microphone. Wait, you want me to do it? I was doing it loud enough, I thought. Anyway, it is with great honor we present Chris R. Jenkins with our Chris R. Jenkins Amazing Citizen Award. In recognition of your idea of honoring those within our community, your Amazing Citizen Award will forever be known as the Chris R. Jenkins Amazing Citizen Award. Your vision to recognize those who go above and beyond to help others is a testament of your leadership and 50 years of serving the Culpeper community. If you didn't know, it was a little bit more than 45, so he did the 50. The Culpeper Police Department will always follow your principle of honoring those who serve our community without any expectation of acknowledgement. Congratulations on a lifetime of service, March 2nd, 2023. It's like two bookends right here.
Get that dust, Mike.
Now, we'll let the chief have the microphone again, and this time without any wine. I feel better about this.
Manager's worried about telling my story again. First of all, it's just great to be back here among so many familiar faces, though I haven't really been gone so long. But it's an honor to be in the Roscoe H. Ford Police Building. This was the very first building in the town owned that ever became named after someone. And I believe Pronis was on council when we were able to do that. So it was great that the town was able to honor such a icon in my career in growing up in Culpeper. The Chief Settle was exactly right on how this award came about. And again, it's easy to come up with these lame-brain ideas, but it takes a lot of hard work and dedication and commitment to pull off what you see in this room every other month, as you do. And just to acknowledge a few of those folks that have made a lame-brain idea into reality, and really, it's quite an ordeal, the recipients of this every year. And if you've ever been allowed into the room where these decisions are made, again, I think they probably can name a pope easier than we come up and name an amazing citizen. But I take a lot of talented folks, Chief Settle. I'm gonna miss somebody's name, and I'm gonna get in trouble here, but I'm gonna try to do this. Deputy Chief Tim Chilton, the whole Community Policing Division, Lieutenant Banks, Sergeant Caruso, Julia Cole, Jason Smith, Mike Grant runs around here, helping with get the prizes and stuff. Jason Smith, if I didn't mention his name. The folks that does the food out there that Roscoe Ford taught me many years ago, you feed them and they will come. So we, as the father of a Neighborhood Watch program, Captain Andrew Terrell is here tonight, and we honor him, newly promoted to captain. Congratulations. It used to be light fare, as he would say, and now I'm seeing fried chicken and all this. I'm not sure who does y'all's budget here, but it's great, folks, and the ladies out there, Stacy Nicholson and Rebecca Bennett and Pat Soley, Sharon Brown. Thank you. Keep rolling here. Catherine Butler. And then all the sponsors. As you can see, the list keeps growing, and the truth be known, when we started this idea, actually many of these folks contacted us and wanted to be sponsors of that, and wanted to, as they saw the same vision we saw, being able to honor and reward folks for going beyond the call of duty. Another person that has been a big part of this, and actually has been in that room where the smoke comes out of, but is Johnny Krawchuk. The amazing video that he does each month even though most of the time we're still on the cutting room table on the 11th hour. But somehow John always scores a touchdown for us. And I think that makes the story is really told in the video each and every month. And did I forget anybody? Probably did. Takes a lot of folks, but actually there would be no Amazing City if it wasn't for all of you that come each month to support us. And it's a great community. And there are a lot of amazing folks, and we only do it 6 times a year. So there's only six awards. So maybe the new chief will come up with a better way to get out more people an award. But we could maybe have Friday night chicken and have a different menu. If I could fix income, I could definitely come by every Friday night and enjoy that. But as far as the topics that we would bring in, folks, just like tonight, you got a great on-point presentation that's headed your way. And by Johnny being here to be able to live stream this and put it on demand on our local channel, and the incredible support of council. I must tell you, they told me to fill some time, so that's why I'm kind of babbling on and that. But early on when we did this, it was a council person from Orange, I think it was Orange supervisor or something, and they were doing a neighborhood watch meeting at the Lake of the Woods, and he attended one of ours to kind of get some ideas, and he said, how in the world do you get all these elected officials? We can't bribe them to come out in Orange to come, and look how many we have. Typically we've had as many, almost as probably 8. We've almost had a whole quorum here each meeting that we have. So tremendous support from our council members, our mayor, our former council folks, R.E. Dean, who remembers me when I was the junior fireman who added on to those 45. And he's still going strong, dedicated to our community and service. So again, the room is full of folks right here that's very deserving of an Amazing Citizens Award. But make it hard on Chief Settle. Don't give him easy picks. Keep sending in these nominations, because I'm telling you, you all know there are folks tonight. Unfortunately, Joan and David couldn't be here, but these are 2 folks that have, since they've been in Culpeper, they just do amazing things behind the scenes, never looking to ever be recognized. And that's in and of itself. I mean, there's some folks that can't wait till they do something and they put it on Facebook to everybody in the world can see it. But these are folks that do the little things right. So it is very humbling to have an award named after you, and I'm still alive. So that's, it's great to see that. It's great to be alive. And so I thank Chief Settle and all the folks who came up with that idea at the retirement party. I have to say, typically somebody leaks something. You know how leaking goes, kind of like what goes on in politics, for a lot of politicians in here. But that did not get leaked out. That took me by surprise, to be honest with you. And it's very humbling, and I'm very appreciative of that. And, Culpeper is my home, born and raised here. I will always live here. I'm here to continue my service to this community, and I will continue to do that. But you're in fine hands. Believe me, you have a great group of leaders in this agency. Chief Settle, Deputy Chief Chilton. I guess I better not say anything about that. I can't get in trouble no more, though.
I broke the internet yesterday, so
And Chief and Captain Terrell. We have new sergeant was with us a few minutes ago. I think he left. He had kids to go out and celebrate ice cream with. So that's a great thing about promoting within house, is that everybody gets to kind of move up the ladder and continue. These are folks that know our community and continues to serve the community in a community-oriented approach. We can't do this on our own. Never been able to do. I never did a single thing on my own. It was a combination of great support in-house and the great support of our community. So I thank all of you for giving me the opportunity each month to stand here and just be a small part of this, and to be able to have this award named after me is, I'm not sure I deserve it. If you look at the list of winners that are on there, it's a pretty all-star cast of folks, and David and Joan certainly belongs on that list. And I look forward each month to seeing each neighborhood watch me to see who the winner is of this award, because I think it's our community is so enriched with leaders and behind the scenes. So I thank you all. I'm going to shut up now, and I got a door prize ticket tonight too. I'm eligible to win a door prize. Thank you.
So as a common practice, we have a couple of gifts for the honoree of the Chris R. Jenkins Amazing Citizen Awards. So, Tim, that's not the flowers from the garden. So one of our sponsors is the Garden Spot. That's something for Jenkins to kill when he gets home.
It needs water, so.
Yeah. And we have one thing I can say whatever I want to. Now you can't. I'm sorry. He gets that one? We'll give him that one too. One thing, I can say things now and I get in trouble. So, a couple of things that you don't know about Chief Jenkins is, one, he's a TikTok freak. Like, he loves TikTok. And he sends a lot of TikTok videos. And at nighttime, you get a lot of TikTok videos. And I think late at night, he lights a lot of candles and he watches TikTok. And that's kind of his thing. So, yeah, he does. He probably does. So in honor of his, and he loves candles, right, Stacy? He's a big candle guy. Loves his candles. Yankee candles. So we're gonna give him a couple candles. That's from Poppy and Chalk. You can light that up tonight while you're watching your TikTok videos. And then there's another candle there, Tim. We're gonna load him up with candles because he's gonna need them. He's on a fixed income, so we'll give him plenty of candles.
Since he's hurting for money, we're gonna give him all this stuff. Can you pass that around? Sure.
And then Stacy's telling me that he gets these pretty flowers over here too. And hopefully he gives them to me so I take them to my wife later. Now, this is going to be a cute picture. Garden Spot, right? I'm sorry? Endless Creations.
Endless Creations, flowers and gifts.
Oh, yeah, take that picture. It might be a coconut cake in the bottom there somewhere. Some poker rolls or something. So the rest of the door prizes, and that's all the gifts. But again, we want to thank Chief Jenkins for coming and kind of filling in. We're kind of going to do this anyways, but kind of filling in for Joanne and Dave. Again, Joanne and Dave will be honored on May 18th at our next Neighborhood Watch meeting. And but we thank him for letting us name this award after him. And he is welcome here. We hope he comes here every 2 months and just to come give us a hard time.
My key didn't work today.
Yeah, we've got to turn it off. But anyways, thank you, Chief, for coming, and thank you. And we're going to take about a 5-minute break, and we're going to set the room up. And we have a great program for you guys. The health department here is like the Chief said, has an on-point message that everybody should hear, and our audience at home should hear. And we'll take about a 5-minute break, and we'll see everybody here. So go get more food, get more water. There's brownies, there's cookies. So please help yourself. Now the moment we've all been waiting for. A couple quick announcements before I introduce our guests tonight. As Chief Jenkins stated, that we do have a couple of promotions that we made within the Culpeper Police Department, so we're very excited about that. And I think this is the last time I'm speaking, and I'm going to shut up the rest of the night, so I want to make sure I make the announcements. Andrew Terrell, Captain Terrell, is around here somewhere. Chief already introduced him. He got promoted to captain from the rank of lieutenant yesterday. Sergeant Scott Last, who's one of our nighttime sergeants, got promoted to lieutenant. So he'll continue his service here at the police department as lieutenant. So we congratulate Scott Last. And then, as mentioned before, Master Police Officer Christopher Campbell is now promoted to sergeant. So we're very excited about these leaders, and like the chief said, we're in very good hands. And we just want to make that announcement. Captain Terrell just stepped back in. I know you guys gave him applause earlier, but he's the stoic gentleman in the back there. But he's our part of our command staff now and be making a lot of critical decisions. And you'll be seeing a lot of him now at community events and all of our outreach functions. So congratulations to the three promotions. Also, Captain Tim Chilton will be serving as our Deputy Chief of Police and be taking over duties when I'm not around. So that's also was a big announcement yesterday too. So we congratulate Captain Chilton as well on that. Having further said, I do want to recognize Deputy Andre Jackson from Madison County Sheriff's Office here tonight. He is here observing. We're honored to have him and flattered that they're trying to start a neighborhood watch program in Madison County and thinking about doing a combined neighborhood watch meeting. So he wanted to come tonight and watch and observe. So our doors are always open to anyone who wants to come. So thanks, Andre, for coming tonight. And tell Sheriff Weaver to come on. You can come on back anytime. So. Without further ado, our two guest speakers tonight are our resident experts of our health district. Both of them have been doing it for a very long time, maybe longer than I have doing police work.
I don't think so. You're my favorite.
Our Rappahannock Health District are great partners for the police department. When we call them, they come and they provide us whatever guidance and assistance. I know I've called April and Kathy many times on issues facing our town on health matters. And as we all know, heroin and opioid addiction and overdoses is an issue in our community, like other communities across this country. And Kathy and April are in the fight with us, shoulder to shoulder, trying to combat heroin, opioid abuse and overdose, and they're around the front lines with us. And sometimes they get kind of overlooked in the back of the front lines, but they're right in the fight with us. So it's important for the information they have. It's on point to every family in our community to make sure they have this information. So without further ado, April and Kathy.
Thanks, Chief. Can you guys hear me? All right, you can go ahead and go to the next one. I'm going to get us started. My name's April. I work now, my title is Population Health, but to my core, am an epidemiologist. And you'll see that a little bit as we go through the slides and talk about this. And I'm also pretty informal, so if you have a question, just raise your hand, and I'm happy to answer it as we go. So the first thing I wanted to talk about is, what is public health? I think people think about their local health department, but maybe don't know exactly what that means and what we do. And so public health really is what we do as a society to ensure the conditions that everyone in the community has the opportunity to be healthy. Public health involves all of us. Part of public health is recognizing that the things that impact our health aren't always just biology and genetics. They are social, they are economic, and they are political. And we're going to talk about that as we go through tonight. Next slide. So who's in charge of public health and what does that mean? And spoiler alert, public health is a team sport. And everyone on this slide has a role to play in making our community a healthier place to live. Something that we do at the health department often is facilitate. We facilitate relationships between all these parties and encourage everyone to think about health in all policies. Sometimes our data drives policy. If we find, for example, one of the things that was studied was higher rates of lung cancer in folks that worked in restaurants or in bars. And the policy changed, and smoking is no longer permitted in the state of Virginia in that environment. And that made a difference for every employee that worked there. Sometimes it can be one person that starts a sea of change. And so if I throw out the name Candy Lightner, anybody in the room recognize that name? So Ms. Lightner in the 80s had a daughter who was 13, and she walked one afternoon to her church for the carnival. And when she walked home, she was struck by a car, and she died. The driver of that car was drunk. In the 80s, the laws were not on the books to make that a heavy crime, and so the driver essentially got away with a slap on the wrist. And understandably, that mom was really, really ticked off. And so what did she do? She created a community group called MAD, Mothers Against Drunk Driving. That became a state group, and then a national group, and then an international group. It effectively changed laws in practically every state, and she's credited with reducing losses, fatalities, from drunk driving by as much as 40%. One person, one community started that. This is public health. Next slide. So how do we get this data when we talk about wanting to make changes in our community and making a strategic plan? And so one of the ways we do that is through a community health assessment. And we're doing that right now. All those partners on the bottom of that slide are involved, and that's something that is unique about our community. From a hospital perspective, the IRS mandates that they do a community health assessment. For public health and our foundations, we do it because we want the information. But this is really a unique thing for our community, and it speaks strongly to the relationships that we have here. And that is an asset for everyone that lives in our community. Some of the data that we'll look at will be quantitative. And what I mean by that is it's how many people live here, what's your income, what is making people get sick, what's causing our deaths. Some of the data will be qualitative. And that's what that QR code is for. If you hover your phone over that or you see it at home, it will link you to a survey, and your voice matters. We want to know what you think is important in this community, what's working, what can we do better, what's missing, what is causing our community to have a lesser quality of life than we want them to have. So I encourage anyone listening to take that survey. Your voice matters. We want to use that information to provide strategic direction for all of our partners on how we allocate our resources to improve the health of everyone that lives here. Next slide. So I'm going to go through a little bit of data, and this is our national picture. So this is across the country, what are our top causes of death, and this is from 2020. And you'll see it goes bottom up. Number 1 is heart disease, number 2 is cancer, and number 3 is COVID-19. If you go to the next slide, we're going to see what's happening in Rappahannock-Rapidan. They're flipped. Number 1 is cancer. Number 2 is heart disease. Number 3 is unintentional injury. And why is that important? Because when we count things, right, when we count things, we want to put them in buckets, and they all need to match and be the same across the country. So we're counting an apple to an apple. And the way that we code an overdose death is as an unintentional injury. So we have enough in Rappahannock-Rapidan that it is our 3rd leading cause of death. So that's not all overdoses. I don't mean to imply that. There are other accidents and things in that criteria. But the overdose deaths are swaying that to put it on number 3. Next slide. So we're going to walk through 3 slides now that show you our overdose deaths. These are fatalities in Rappahannock-Rapidan. And just a reminder, that's Fauquier, Culpeper, Rappahannock, Orange, and Madison counties. If you look at this slide, the blue line is Virginia, and red is our health district. And I want you to look at 2 things. One is we used to be well above the state rate, and unfortunately, the state has caught up to us. But the trend line is it's an increase. From start to finish, we're increasing. We're headed in the wrong direction with these fatalities. The next slide, and it's the same scale, it's rate per 100,000. The next slide shows you that of all of our overdoses, most of those are opioids. And if you go to the next slide, of those opioid overdoses, most of those are fentanyl. And if you go to the next slide, this one is then just sort of for informational purposes. These are our opioid overdoses that exclude fentanyl in the calculation. So just to reiterate, we have a significant problem in Rappahannock, Rapidan, mostly opioids, and most of those are fentanyl. Next slide. And so this one, I left out a slide. I'm sorry. I thought of it when I got here, and I can send it out afterwards. But this is a different data set. These are emergency department visits, and the rate is per 10,000 people. We collect data in Virginia. It's actually something that came after 9/11. The system is called Essence. The system was created so that we could potentially detect bioterrorism. So if you go to the hospital emergency department in Virginia and select urgent cares, your data, select pieces of it, it's de-identified, are fed into a database, and then we review it every day, and we're looking for clusters. And so, for example, we want to know if a group of people presented with a rash. Did a group of people present with a gastrointestinal symptom? Although we're not using it in this sense to detect bioterrorism, it is very useful to help us monitor the state of our community. So we use it for things like influenza surveillance, and now we're using it to monitor overdoses that present to an emergency department. If you take that data and you put it on a slide and you separate out by age, the age group at the top with the highest rate of emergency room visits is 15 to 19-year-old kids. I have a 16-year-old at home, okay? That strikes fear in my heart. When I took that information and filtered it out for our area, the slide that you're looking at shows you that of those 15 to 19-year-olds, so of that group that was at the top with the most visits, the bottom line is Virginia, the next line up is the health district, and the yellow line above that is Culpeper. So our kids are going to the emergency room for overdoses in numbers that are above both the health district rate and the state rate. And our kids don't always make great choices, right? 16-year-olds are impulsive, and they could be in the bathroom and someone says, taste this, try this, take a smoke of this. We don't want them to die for it. That's if you remember anything that we tell you tonight, we want to keep our kids and our community safe. Next slide. And so when we think about opioids and substance use, there's always sort of the question of well, what does this mean, and how do we define it? And I'm here to tell you that anything that impacts the morbidity and mortality, or the rates of illness and the rates of death in a community, in the way that opioids are impacting ours, is a public health problem, and we need to deal with it like a public health problem. What that means is we all have a role to play, and there are all kinds of things we can do. We can increase awareness. We can invest in prevention. We can invest in treatment, and we can invest in harm reduction. A public health approach works to address all those factors, whether they're individual or community, social, economic. That public health approach tries to address all of that in an effort to make our community healthier, reduce the need to use a substance, and help those that are using get the help they need and get on a path to recovery. What I'm going to ask you to do is think about substance use and abuse as a medical issue, not a moral one. Next slide. So when I said one of the things we could do as a community to target this issue is called harm reduction. Harm reduction is the backbone of public health, right? It's what we do. We take behaviors, we look at them, we observe them, we figure out the impact to the individual and community, and then we recommend interventions to make those behaviors safer. We want you to wear your helmet when you ride a bike. We want you to have a seatbelt in the car. We want people to use condoms when they have sex. And when it comes to substance use, we want what? I would like to have Narcan available so that if someone overdoses, you could save their life. I would like to have fentanyl test strips available so that if the person is addicted and using, they can test that and then make it maybe a different choice. Maybe they would use less. Maybe they would use in the presence of someone else who could help them. All of these things are meant to reduce the negative consequence of the behavior and provide us an opportunity to reach that person, begin the conversation about recovery, and connect them to the resources that can help with treatment. Next slide. And so my grandma was an English teacher. I should probably mention that. When we think about substance use, if you think about it as a medical issue, an example I use sometimes is if you went to the doctor and they told you that you needed to exercise. They are not going to tell you to go run a marathon on Saturday because that would be unwise and dangerous. And so if we treat substance use as a medical issue, then we need to target all the things that could help the person on their path. It is multi-component. There are a lot of steps, but we have ways to encourage, to empower, and link with resources. So I think my main message is that public health is all about prevention and working collectively to address these issues. And then our next speaker, Kathy, is going to tell you how to save a life and keep them with us to give us that opportunity. So any questions for me before Kathy takes over?
What is the population of the, or what's the population of the district?
About 180,000. 185. No?
I got a question.
Oh.
Can you remind me, there are schools, harm reduction as far as Narcan, is it available in our schools, and how are they running that?
So the question, in case everyone didn't hear it, is Narcan available in Culpeper County Public Schools? And the answer is yes, to a limited degree. It's available in the nurse's office, but with all medications in the schools and the nurse's office, it's locked in a cabinet. A public health approach, a recommendation would be to be strategic about that, right? And so in some of our counties, what we've done is we've gone in and trained different groups of people. And so we might train all the gym teachers or all the librarians or people in the cafeteria, because the goal is some of these schools are large, to have Narcan around the school so that if a child did overdose, someone's not sprinting across the whole school trying to find this one box that's locked in a cabinet. So that definitely would be a public health recommendation, is to apply a strategic approach and have multiple access points for this. It's under FDA review right now. We would love to have Narcan be over the counter. Right now, by law, it has to be prescribed to an individual. And so if you get it tonight, the box will have your name on it, even though we know you're not going to use it on yourself. But that's a limitation for us. But a way to work around it is just prescribe it to different people throughout the building.
Just a quick question. You had a chart a few slides back showing the trends for 15 to 19, and it looked like the numbers were trending down a bit over the last couple of years. Do you forecast that continuing, or what do you see projecting from that?
So I can't predict the data, right? I can only show you what it shows me right now, and I don't have an answer for that. I'm hopeful, of course, that they will trend down. The concern with that particular data point is these are kids that present to the ER, and we know we've increased Narcan in our communities. And so my concern is that we are missing folks that don't go to treatment.
Will doctors prescribe Narcan, say, to a citizen just to?
So a physician can prescribe Narcan to their patient, and it's a recommendation for some if they know they're a substance user or if they're getting certain high doses of opioids and they're concerned. That always varies on whether or not the person's insurance covers it, what the copay is, and if they would have to pay out of pocket. So you can come to us, and we will provide it for free.
Do you have enough?
We, great question. For now, we do, and Kathy keeps ordering it, and they keep sending it. And so until they tell us no, we keep putting the order in.
Okay.
I didn't see it, Chief, sorry.
I think you implied the answer. So you don't actually have a record of when it's used in the district?
No. The question was, do we have a record of when it was used? And no, we do not.
I would be remiss if I didn't bring this up, and I'm not trying to change the narrative of your presentation. But on the front page of our paper today, Jim McGrath, Executive Director of Rappahannock Community Services, presented a state of what exists in Culpeper. A lot of this was discussed, but as well, the rate of suicide in our community is rising. And mental health issues are rising in our community. And so much of both of those do tie in with substance use and abuse as well. So I just throw that out there because it is certainly a multi-community approach that it will take to make those numbers go down. And the value of prevention, particularly in our schools and where we're reaching our kids, I think is one of the keys that we need to reach out to. So, and you spoke, you started, there's a political aspect to all of this. And the schools, if you approach them to discuss why aren't more being done in our schools with prevention, particularly to suicide, is that they are structured day. They don't have enough time to put in these issues. Bullying of our kids leads to a tremendous number of suicides. And the programs in the schools, predominantly in the whole 5-county district, are really lacking in prevention efforts. So, you know, my association and prevention is one of the keys. So I just would be remiss not to throw that out there because they do, you know, mingle so well in causing the data to go up. And if you listen just to the kids in their the report that's just recently came out, the kids are crying for help in our schools, and I'm not sure that the communities are responding to giving them the appropriate help. Maybe a few comments on that.
We stand ready with Jim McGrath and Community Services to try to address all of those issues. I think that, and I think David stepped out, but as we're doing our community health assessment, we are putting a focus on trying to find some indicators for mental health and see what we can do to bring new opportunities and ideas into our community. One of the things, and it's preliminary to talk about it, but one of the things we're trying to do is use a lot of money funneled into our communities from COVID, right? And it's all earmarked for COVID, but it's also earmarked to assist those disproportionately impacted by COVID. And I think that our students and anyone dealing with those issues certainly fall into that category. And I'm working with Jim McGrath to try to divert some of those funds to some things that he would like to do.
Right. And again, we go back to mental health issues. I know in this community alone, we recently had 2 fatalities on folks that probably should have been hospitalized, but because there's a lack of beds in the state system, they're being released. And that's happening every single night here in Culpeper and across the Commonwealth because there's not dead space for those that belong in hospitals. And jails are full of folks that really belong in hospitals. So more of a statement than I'm not asking you to. I know we've had this conversation before, but folks need to realize we will continue to have these numbers going up and fatalities going up until we address some of the root causes of these issues, which is, again, what you're speaking of.
Thank you. Oh, one more.
I may be in the wrong title, but I noticed the number going up. Like I said, I may be wrong, I'm fairly new here, I've only been here for like 5 or 6 years. But the kids have nothing to do here. new rec center's open, if some of the programs there will help you. And there are a lot of people here that are on the boards, mayor, council, and I don't know, like I say, I'm fairly new here. But like I say, there's nothing for these kids to do. And I've talked to some of the people here, and I don't have any do, and that's not in trouble. And I try to tell people, young people, I kind of find help. And I'm not saying I'm doing a whole lot, but I'll tell them, hey, if you can think about doing something, and you think it might be wrong, or something may happen, don't do it. But I mean, sometimes it's like talking that light switch, but I don't know if I'm speaking out of line or what. All I think, the thing is the kids don't have anything to do.
So
They've got to go somewhere and do something. So, somebody's leading them down the wrong path.
I would encourage you to take our survey, right, and put your thoughts on paper about increasing opportunities for children to have a sense of community. I think it's a great idea. All right, this is Kathy Hatter. She's up next. She's going to talk to you about Narcan and how to use it.
Been asked to move this down. Is that good enough? All right. So I'll go ahead and get started. As she said, my name's Kathy Hatter. My job is to plan for how we as a community respond to public health emergencies. And April talked about how public health is a collaborative effort, and COVID-19 is an example of how it's the right slide, if you can make it large. There we go. Yes.
Oh, yeah.
COVID-19 is a great example of how we as a community responded, because there's no way our small public health team could do everything that had to be done during COVID. So Revive is a course that's put together by the Department of Behavioral Health and Developmental Services. It's a standard course, and I've adapted the slides a little bit because we add some things to it that are more local. But if you'll go ahead to the next slide. There we go. So in the fall of 2016, opioids were declared a public health emergency in the state of Virginia. And with that came a standing order for naloxone or Narcan, which we'll talk about in just a minute. But starting in 2017, we were able to start giving out free Narcan in our communities. And the red is Culpeper, and the others are our other 4 counties. And we started in 2017, about midway through the year. And we were really escalating the program until COVID hit. But even during COVID, we gave out Narcan as people requested it. We made arrangements to do one-on-one classes and teach people how to use it and give it out. I get calls on a regular basis from people saying, I have a loved one who's getting out of jail or who's getting out of a treatment program, and I'm worried they're going to use again and they're going to need Narcan. And I'll go meet with them, and we'll have a little quick training, and we'll give them the Narcan, and they're good to go. And so these numbers have taken off in 2022 as COVID has declined, and continuing to take off in 2023. Next slide. I should note there that even before the public health emergency, even before we started giving out free Narcan, the town police was already on top of this. They were noticing the trends, and they were dealing with how do we respond to this increased number of overdoses in our community. So I get lots of legal questions about this because, as April said, the only method I have to give you Narcan right now, and I should deal with this, Narcan and naloxone, exactly the same thing. Narcan is the trade name, naloxone is the generic name, and I'm not good about being consistent, so I apologize. But the only way we have to give you this medicine is to prescribe it for you individually. And who's supposed to take a medicine that's prescribed for you? You are, right? And I'm teaching you how to use it on somebody else. And so people say, how is that okay? I'm not a doctor, I'm not a nurse. How is it okay for me to take this medicine prescribed for me and give it to someone else? The Good Samaritan law covers you as long as you are doing your best to help somebody and you're acting within the scope of your training. And the training I'm giving you right now says, I understand that you may use this on somebody other than yourself, and that is okay. As a matter of fact, if you're giving it to yourself, you don't need it. Because if you're awake enough to give it to yourself, you don't need it. It is perfectly understood that you may use this on someone else, okay? Go ahead to the next one, please. Another legal question I get is okay, what if I'm somebody who's using drugs and I'm using with my buddy. And I notice that my buddy is not breathing well and is looking like they need help. If I call 911 to get my buddy some help, I'm going to get arrested for using drugs. And so there's another legal provision out there that says if the only reason we know that you're using drugs is because you did the right thing and you called 911 to protect your friend, then we can't arrest you for that. Now, it doesn't mean we can't arrest you on another day at another time if you're using, but for that particular instance, because the only way we know is you did this safe reporting thing, you're protected. Go on to the next. So right after they declared the public health emergency, the state health commissioner issued a standing order for naloxone. And one of you asked about getting your doctor to write the prescription. You don't need your doctor to write you a prescription. Anybody in Virginia can go to a drugstore and say, I'd like to get Narcan, or I'd like to get naloxone, same thing. And it's like there's already a prescription with your name on it. The pharmacist will give it to you, but they're going to require you to get a little bit of training on how to use it. That's sort of part of the deal, is you have to understand how to use it. We're covering that here tonight. With the standing order, you can get it at a pharmacy. You can pay for it. It's not cheap. I'm hoping when they make it over the counter soon that it will become less expensive. But we have it for free at the health department, and we also have it for free at our community service board locations at the C Center here in Culpeper. And so before you go pay money for Narcan, please check and see if you can get it for free. Next slide, please. Addiction. So back in 2017, when this first started, we were really seeing overdoses in two distinct groups. This is not everybody, but there were two kind of larger groups. One was people who were maybe either trying to commit suicide or who made a mistake with their medicine and just overdosed by accident. And the other was people who were addicted, people who could not stop using and were struggling with addiction who would overdose. And addiction is a horrible place to be. It is truly a medical illness, and we want to keep those folks who are suffering with addiction alive until they can get the resources they need. But as April mentioned, we're seeing an increase in overdoses in teenagers, and so I add a third group here, which are teenagers specifically who are getting one pill through social media. They're buying one pill, they're doing it over Facebook or over Instagram, and that one pill, they're thinking it's something that's going to help them study for a test or just make them feel better, and it turns out it's fentanyl. And so we've definitely seen that increase, and those are folks that, they made a mistake as a teenager. Should they die for that? Absolutely not. We want to prevent that death. Often I show a video here, but we're not going to do that tonight, but I have the QR code for that video. And if any of you all want to watch it later, please do. Come scan the QR code at the end of this. If you're going to watch it, it takes about 5 minutes. I recommend you turn the lights down and the sound up. And it's just a real good picture of what addiction looks like. Next slide, please. So opioids. What are opioids and why are we talking about them? Opioids are a particular class of drugs, and we're talking about them because of the way they impact our body. They go to the part of the brain that controls your breathing, and they slow your breathing down until you stop. And so people who die of an opioid overdose die because they stop breathing. So a key message here is if you've got somebody who's not breathing or not breathing enough, and you're concerned that they've overdosed, and you can't do anything else for them, if you just breathe for them, you might be able to save their life, okay? We can do more, but if that's all you can do, you might make a difference there. Go ahead to the next slide, please. Here's a list of common opioids. The left-hand column is the generic name, the middle column is the trade name, and then they also have street names. And there are a ton of different ones, and I will tell you that the street names change, and there are always new developments. Okay, but pretty much anything, most of the medicines you might be prescribed for pain are considered opioids. One thing that's changed since 2017 is a lot of education for our physicians on making sure they're prescribing the least amount of pain medicine that could possibly be needed for the situation and making the patient come back if they need more, because we really want to encourage people to get off opioids as soon as possible after like a surgery or something. Next slide, please. This is a campaign that's being done nationwide. One pill can kill. You'll look on the bottom right-hand corner. On the left is oxycodone, and on the right are fake oxycodone. They look just like what you would get from a pharmacy. And so a key message for our youth, our teenagers, is if you're getting pills somewhere and it's not from a pharmacy, it's not from a bottle that you got at the drugstore or the grocery store that came sealed, if you're getting pills anywhere else, they are not safe. You really need to only take pills that come from a trusted source. Because if you don't know where it came from, there's no telling what's in it. And if you bought it over the internet, it's probably going to have fentanyl in it. Next slide, please. I'll mention that we also have, as I said, drugs change over time. There's this new class of drugs called nitazines. They have several different names. They all end in zine. These are also opioids. They're very, very strong, and they may not respond to your Narcan. It may take multiple doses of Narcan, and we're going to talk about fentanyl test strips in a few minutes. They may not be detected by fentanyl test strips. Okay. I have not added the next slide. There is also something out there called xylazine. It's not a Z-E-N-E, it's a Z-I-N-E. And we're finding that combined with fentanyl. It is not an opioid, but it does make people sleepy. It depresses their respiratory system. And it is very powerful as well. And that's a recent introduction to the drug market. Next slide, please. I get teenagers who say, you know, my parents have talked to me about opioids. I'm not going to use any opioids. I'm just going to smoke pot, right? You know, marijuana is getting legalized. I'm just going to smoke pot. Again, if you don't know where you got it for sure, if it didn't come from a reputable shop, first of all, if you're teenagers, it's not legal for you. You have to be over 21. But if you didn't get it from a reputable place, it's likely to be laced with opioids, and it's not safe. Next slide, please. So I kind of covered this already. In an opioid overdose, the opioids, you get them in your bloodstream, they go to the part of the brain that controls your breathing, and they slow your breathing. Next. What makes somebody more likely to overdose? Any ideas? Nobody? Age? Well, actually, overdoses are all ages. There's a lot of things in public health we can say this is mostly affecting, men in this age group or women in this age group. This is all gender, all age groups, all ethnicity, all races. It crosses all those barriers. Go ahead and hit next slide. So certainly somebody who's overdosed before is more likely to do it again. Somebody who has recently had a period of abstinence, and by that I mean they've been in jail and have not been able to use drugs, or they've been in a treatment program and have not been able to use drugs. If they come out, they have a reduced tolerance, and if they use at the same concentration they were using before they went into that period of abstinence, they are very likely to overdose because you build up tolerance over time if you're using. You hear about kids having pill parties, farm parties, where they just bring in whatever pills, dump them in a bucket, and then take a spoonful of them. Certainly, anytime you're mixing drugs, you're more likely to have an overdose. Using alone, as April mentioned, harm reduction says if I'm going to use, if I have to continue using because I'm addicted and I just can't break the habit, then have somebody nearby who can keep an eye on me. If I'm using alone and I do overdose, there's nobody to help me. Okay. And then certainly some medical conditions will make you less able to process the drugs and more likely to overdose. Next slide, please. How do you know when this is somebody who's actually overdosing and not just high? Any thoughts on that in the room? Say it loud. Breathing. Breathing is a good one. If they're awake and talking to you and breathing, then they probably do not, let me not say probably. If they're awake and talking to you and breathing, they do not need naloxone. Okay? Go ahead and next slide. So somebody who just looks like they've been drinking too much or they've used a few drugs and they're just really happy, but they're awake, they're talking to you, they're just high and they do not have an emergency that requires naloxone, at least right now. Somebody who's overdosed, this is clearly an emergency. They are not talking to you, they are not breathing, or they're not breathing well, and you can't get them to answer you. They're unresponsive. And that's somebody who needs you to call 911, but also needs you to act quickly. Next slide, please. There are some myths on what you can do for these folks. These are all myths. None of these things work. Some of them are funny, but not only funny in a bad way. Putting them in a bath will not fix it. Having them throw up will not get the opioids out of their bloodstream. An ice bath, I have seen people with ice in their underwear, friends trying to be helpful and wake them up from an overdose. It does not work. Injecting milk or salt water into their veins does not work. All of these are myths out there of ways you can fix an opioid overdose, and none of them work. Next slide, please. Naloxone is the only effective way to handle an opioid overdose. Okay, and on the left you see Narcan nasal spray. On the right you see naloxone, and naloxone is just the generic form. And I'm really excited I was very excited when they started sending us naloxone instead of Narcan, because I know it costs less, which means we can do more of this. Next slide, please. Naloxone is a medication that doesn't do anything except it goes to those same receptors in the brain that control your breathing, and it sits on those receptors so that the opioids can't get there, and the person can wake up. Now, it's not always going to wake them up. Somebody who has been down and not breathing for more than 6 minutes, you're probably not ever going to wake them up. That's something we can't fix, okay? And somebody who has taken a high dose may need 4 or 5 treatments of naloxone, 4 or 5 doses. But it can work as quickly as 30 to 45 seconds. And I have seen somebody laying on the ground who looked like they needed CPR, and with 1 dose of naloxone got up and walked to the ambulance a few minutes later. So it can work very, very fast, and it can take multiple doses. It just depends on what they've taken. If you don't know what they've taken, it doesn't matter. Try it. The worst thing that will happen is it won't work. Next slide, please. So it goes to those same receptors in the brain, and it knocks the opioids off the receptors for a short period of time. And that's an important point. Those opioids are going to stay in your bloodstream for much, much longer than the naloxone will. And so anybody who is woken up from an overdose using naloxone needs to go to the hospital, because once the naloxone wears off, they may very well go right back to not breathing again. Next slide, please. It comes 2 doses in each kit, and I have one here. So a box like this, there are 2 of them in each box, and you just peel the package back. This one is expired. People give me expired Narcan on a regular basis. It looks like this. There is 1 dose in here, so please don't push the plunger until you've got it where it needs to be. It goes in the nostril. It doesn't matter which side. And it goes in as far as you can get it and still have room for your 2 fingers on the top. And then once it's in the right place, you just push the plunger. That's it. Very easy to give, okay? We just simply pull it out, put it in their nose, and squirt it. It is a medicine that does not have to be breathed in. It is actually absorbed through the mucous membrane. So even if the person's not breathing, the medicine will still take effect. Next slide, please. You know how when you get a prescription at the pharmacy, you get a handful of paperwork? Well, I have to give you some paperwork too when I hand you naloxone, because it's prescribed at this point. I'm really hoping for that over-the-counter thing. And the most important thing in that paperwork we give you is that your naloxone will be most effective if it's stored at reasonable temperatures you're comfortable at. So it's not something you want to put in the glove box of your car and have it sitting there in the heat of the summer or the cold of winter. If you have somebody in front of you that you think needs naloxone, and the only naloxone you have has been stored at high temperatures, use it anyway. If the only naloxone you have has been stored in freezing temperatures, use it anyway. And if it's expired, use it anyway, but certainly call for help. It's not going to do any harm, but it may not work. And so if you have naloxone like that, then absolutely reach out and get some fresh. Next slide, please. It is very, very safe. When people report side effects from naloxone, what they're really reporting is actually the withdrawal that it gives them. If they were high from the opioids and then they took naloxone, it makes them withdraw, and that doesn't feel good. And so that's really the only side effects you get people reporting. It has no safety issues at all. It's the same dose for adults and children, and it cannot be abused. It's not something people can get high from or get hooked on. Next slide. So let's talk really quickly about what you do when you find that person that you think is having an opioid overdose. Next slide. Make sure it's safe for you to be there. This is somebody laying on the ground unresponsive. You don't know why they're unresponsive. Make sure that whatever made them fall down on the ground and be unresponsive is not going to do the same thing to you. Look around for any issues. If you see drug paraphernalia, you don't want to touch it. Kick it out of the way. If you have naloxone, you also need to have gloves and a pocket mask so you can protect yourself as you're taking care of this person. Try to wake the person up. You can try to tap them on the shoulder, you can pinch their earlobe, you can try a sternum rub, but get them to try to wake up, and if they don't wake up, check to see if they're breathing. While you're doing this, it's listed as the next thing, but I would do it at the same time. If they're laying there and they're not answering me in the first shout, I'm dialing 911 and putting it on speakerphone next to me. Okay, I want help, and I want it sooner rather than later. Next slide, please. Call 911. That 911 dispatcher is your best friend because everything I've told you tonight that you might forget about, they're going to remind you. They're going to walk you through it. So if you're worried that you're going to be too stressed out because it's an emergency situation, you're not going to remember, they're going to walk you through it. They're going to help you stay calm and do the right thing.
And I just want to remind everybody that, because I'm a 911 dispatcher, as I'm taking your call, my partner is dispatching help. Okay, so it's not delaying anything.
Yes, absolutely. Next slide, please. Give the naloxone. If you have it right there with you, give it right away. Let it go ahead and get started. And I already showed you how to do that. Just squirt it in one side of the nose. And go ahead, and it says it can start within 30 to 45 seconds. We're seeing more and more cases where it takes multiple doses, so that may not happen. Next slide, please. Rescue breathing. We want you to breathe for this person because they're not breathing, and that's what's likely to kill them. And so with your naloxone, we give you 2 pocket masks. They're folded up in a little package. They open up. They have instructions on them. This one says this side up. It's got a piece that sticks out over here that goes between the person's teeth. It lays over their face, and you're going to breathe through that. This is going to protect you from their germs, protect them from your germs, and if there's any residue of drug anywhere around their lips, it's going to protect you. Okay? And we want you to give 1 breath every 5 seconds. Now, I will tell you that most people in this circumstance goes way too fast. Okay? You're hyped up, you're energized, you're thinking, no, I got to do something here, and you're breathing way too fast. So count it out. Slow down. And again, that dispatcher, your new best buddy, is going to help you count it out and slow it down. 1 breath every 5 seconds. Go ahead and hit the next slide, please. And you're going to keep doing that 1 breath every 5 seconds for up to 3 minutes while you assess. And keep an eye on your patient there. They could recover in 30 to 45 seconds. They could not. If at 3 minutes they have not recovered, then go ahead and give your second dose of naloxone. Just go ahead and give it. It doesn't matter which side of the nose you give it in. If you want to switch sides, that's fine. And go ahead and hit the next slide, please. Keep doing that. You've given the second dose. You're going to keep breathing for them. And if somebody else shows up with more naloxone and you can give a third dose after 3 more minutes, that's great. And keep working on them and either until help arrives or until they wake up. When they wake up, I want you to remember what I said to start with. Protect yourself. Back up. This is somebody who is going to be disoriented, is going to not feel good. They may come up swinging. They may come up vomiting. You want to back up and give them some room. And they may be the absolute sweetest, nicest person in the world, but right now they feel bad and they don't know what's going on. And to protect yourself, you want to take a step back and give them some room and try to calm them down. Tell them, you weren't breathing a few minutes ago. I need you to stay with me so I can make sure you're okay. All right, please don't tell them I need you to stay with me until the police get here because especially if it's somebody who's overdosed before, they're probably going to try to leave. And remember I said they really need to go to the hospital. Next slide, please. So as I said, Revive is a standard course from Department of Behavioral Health, and it comes with this little blue pouch. In that pouch, you get 2 pairs of gloves and 2 of these pocket masks. You get a card to remind you of what we talked about. You get the case to hold it in. Plus, you'll get your free Narcan. And that is kind of the standard. If you hit the next slide. Locally, we have a little bit different version that looks like this. And this was done through the Community Services Board. It has all the same things that are in the blue bag. In addition to that, it has fentanyl test strips. And I need to spend a minute on fentanyl test strips. Fentanyl test strips are used, their intended use is to test somebody's urine to see if they've been using drugs. This is an off-label use of them, but it is a use that has been very productive and very helpful in several communities that are using them. Somebody who's addicted and continuing to use should test their drugs for fentanyl before using, and if they find fentanyl in them, use less. Harm reduction. We want to keep this person alive until they get the treatment they need. They are not perfect because, again, this is an off-label use. And those street drugs you're getting, if it's a pill, all the fentanyl may be in one half of the pill and you're testing another corner of it. If you get street drugs, you might get 10 pills and you take 2 and think, wow, that didn't do anything. And then the next time you take more, well, the next 2 have a lot more fentanyl in them. There's no consistency in these street drugs. So these are not perfect. They are not, I can't tell you that if you use your fentanyl test strips to test your drugs before using that it's going to save your life. We're seeing good results with them, but it's not a slam dunk perfect world. So if you want Narcan, those of you who are here in the room with me tonight, if you want to get Narcan at the end, you just come up, fill out a piece of paper, tell me whether you want the blue bag or the one with the fentanyl test strips in it, and walk away with it. That's all you need. Those who are watching this on TV, you've completed the training. If you feel like you would like to get naloxone, contact your local health department and ask for it. And they'll either connect you with a nurse at the health department or with me, and you can come in and you can say you watched the training already and you don't need to do the training again. We want to get this in the hands of people who are likely to be around those who may overdose. Whether that's somebody you work with, somebody in your family, somebody in the school, it doesn't matter what reason you need it. We want to get it in your hands if you feel like you're in a position where you might encounter somebody who's overdosed. Next slide, please. And that's it. What questions do you all have for me?
All I can say is, wow.
Yes. I should mention, we have Marilyn and Bob and Benda, right? And Sally Under was here earlier. Some of our Medical Reserve Corps volunteers who support the health department. And we have a number of those who can teach this class and or help give out Narcan. And they were such a huge help to us during COVID-19. I always like to plug them. They gave us 13,000 hours of volunteer time during COVID-19 and were a huge help to us. And if anybody's interested in joining the Medical Reserve Corps, I can help you with that as well. So that's all I have. At the end, when we're done, if you just come up, it's a quick piece of paper. We hand you what you need, and you can take your naloxone with you if you'd like some. If anybody in here has naloxone but thinks it might be expired and needs a fresh one, you can come up and get that as well. Thank you all for listening.
So some of the things that we're doing with Narcan as well, Matt Hayes will be up in a second. We're actually doing some trainings here at the police department too, along with our HIPS program, which is the Hidden in Plain Sight program we do. I think Jason Smith's in the back, Ashley Banks and Mike Grant do those trainings. I think we're in 29 counties now. Is that where you guys have been? Is that right, Jason? So they've been around to 29 different counties in the state now and have taught this presentation. And what it is, if you don't know about it, it's a mock bedroom, and it's basically to educate parents and teachers on all the things that they're probably looking at in a day-to-day basis that's hidden in plain sight, hence the name. But it's an eye-opening presentation. It's so many things that are in that little bedroom that the kids are bringing to school, that they're using on a day-to-day basis at the house, and parents are going in the room and have no idea what they are. The presentation was picked up. It was one of those other lame brain ideas you had, wasn't it?
Actually, the Wellness Foundation
Yeah.
came up with it, and they paid for it.
So the Path Foundation they put up the money for it, and they bought the trailer, they bought all the items that went in with it, and all this, the training that the guys went to get the original part. But it was spearheaded by Chief Jenkins at the time back then, and it took off like crazy. They've taught 6 other departments now that have their own programs, and so the thing's growing just as much as any of the other programs that we do here at the office. The community involvement that we're getting, we're doing these right here in the office. We've done 2 in the last couple months, and I think we've trained about 40 or 50 people with Narcan. So the numbers that these guys are giving out for the overdose numbers, the reason they're declining in our area is obviously when our folks are getting to the calls, they've already been Narcan. So that's because we're getting it out in the community. These guys are getting it out into the community. So when our first responders get there, our police officers are getting there to the call, and they've already been Narcan once or twice. So most of the times, or not all the time, but a lot of the times, the victims are already coming back too from the overdose episode. So, but those are a couple things. So my part of this is talking about some of the things that we're doing still for the month in the upcoming months, and we'll have a couple more of these HIPS programs coming up and the Narcan trainings that'll be here. Matt's going to be getting those straight and putting the dates on our Facebook page here in the next couple weeks. New Chief Settle, this is one of his new ideas. He is going to be starting the community walks, and the community walks is going to be the first couple is going to be with all of our lieutenants. So a lot of our lieutenants are night shift lieutenants. They're There are folks that are in different groups, and you don't normally get to meet them because unless you go to a call with them, you're not going to see them. So these folks, along with the command staff, will be doing these community walks, and it's basically to get out and get our faces in front of more people and get all the folks that are doing the work at nights and during the day so the community can understand who these people are and, be able to easily approachable at that point. The first one is at April 6th, and that's going to be at Bell Court and Culpeper Commons. Yes. So it starts at 6:30, and that walk will go through both of the neighborhoods there, and it'll end up at the gazebo over in the middle. So that's where some of the kids, and we'll have stuff to give out to the kids. We'll have literature for the parents and everything else too. So if anybody has a neighborhood that they want us to walk, we will certainly add that to the list. Call Julia Cole. Julia Cole will be able to put it on her list, and we'll be able to add these to our events for anything that you guys might want for your community walk, that is. Open house is coming. We're going to do an open house for the community here. We're going to have static displays throughout the building, throughout the parking lots. Jason Smith's going to cook food, so if you follow Jason Smith's Facebook page, yeah, that's all he does is cook food, I think. So, but he's going to be Jason's on the grill, so if nothing else, just like Jenkins was saying, if you feed them, they'll come. So you'll certainly have food that day, but there'll be a lot of different displays out there. And some of those different things that we're going to do is we're going to show you what each of our areas of responsibility are within the building. And if you don't know how much we really do, this will give you an idea of how much goes on within the agency. And we do have, this is a little light announcement, but our emergency response team is finally back online. That's our version of the SWAT team, but we have a different spin on our team, and ours focuses on mental health as well as our less lethal options and things like that when we go to these calls. We were used for the first time the other day, and they had a great response. They were able to do everything they needed to do. We've been able to establish a training regiment with the hostage rescue team from the FBI. So our guys, your local HR or emergency response team here is being trained by the best team in the United States. So that's unheard of to be being trained by these folks. And they come every month and train our guys for free. And their medical teams come and train our guys for free every month. So it's you have a safe team, and you have one of the best trained teams in the region because of these folks coming here in the context that we were able to keep with all these folks over all these years. So any questions about the walks, any questions about our Narcan programs or any of our stuff that we're doing?
Do you have a date for the open house?
The open house, I think, I don't know if we've actually got the date on that. I want to say it was the 13th. What's that? Sometime in May. Okay, it's probably going to be a Saturday is what we're talking about, trying to get more folks in. So we'll set it, and then Julia will put it on the page and stuff like that. Anybody else? Come on, Bob, you don't have a question? Okay, thank you. Next up is Matt.
So next is Detective Hayes, who is going to give us a update on our crime investigations.
Hello. Kind of off topic, just to show you how well the training that these ladies just gave you works. While they were giving that presentation, our patrol officers responded to an overdose and reversed it using their Revive training. So just a little insight on that. So what I'm supposed to talk to you tonight is about scams. They're very common. They're certainly on the rise. They come in a lot of different forms, and they affect varying age groups. So in front of you is a pamphlet from the Federal Trade Commission. It's like this. So I encourage you to take that with you. But there's just a couple of key points in here. You've got a couple of signs that it's a scam. Scammers will always pretend to, well, most of the time, pretend to be someone that you know or an organization that you trust, such as the Social Security Administration, doctor's office, a bank, anything like that. A quick example in my own personal life of this is a couple of years ago, Someone called my grandmother and pretended to be from a sheriff's office in Florida. They said that I was under arrest and that she needed to send $3,000 in order to get me out of jail immediately, within 5 minutes. So they presented themselves as someone that's trustworthy, right, a sheriff's office. They presented that there's a problem, which is part 2, and then they pressured her to act immediately. So the way that she avoided paying $3,000 is she felt like something was off. So she called me, which was a smart move, right? I answered and I said, no, I'm not in Florida. I am in Warrenton, Virginia, where I live, and please don't pay them money. But another way that they will present to you is that it's a prize. This comes in the form of secret shopper. There's other names for it. What they'll do is they'll say, hey, you won $3,000. All I need you to do is go to the bank and deposit this check and then send me $500 for a fee. That's just an example of it. Well, what actually ends up happening is that check bounces because it's not real, and then you're out $500 because you sent it to somebody. The Social Security Administration, the police department, a bank will never call you and ask you to verify your Social Security number or to give your bank account. There's various examples. They will also allow you time to verify who they are. Example today, I called somebody and they didn't believe that I was a detective, so I allowed them to call the police department to verify my employment. A scammer will not allow you that opportunity. Ways that they will ask for you to pay is by MoneyGram, maybe a check, a digital currency like Zelle, Venmo, PayPal. A very common scam is that they will ask you to go to a store like Walgreens, Walmart, and get gift cards and scratch off the back of the gift card to display the numbers and then send them a photograph. They will immediately cash that out. Some ways the best way really to avoid falling for this scam to begin with is to just talk to someone. If you're married, bring up what's happening to your spouse, and it may help you to realize that something's just not right. Also, don't be afraid to call the police and ask to speak with an officer about this. We talk to people about this every day. We don't think it's silly, and I, for one, would much rather talk to you about it over the phone than, investigate it later on and you be out of money. If you take the pamphlet with you, there's a link on the very back page. It's reportfraud.ftc.gov. If at any point you think you were scammed, in addition to calling the police, fill out that form. I filled it out myself. It takes like maybe 1 to 2 minutes. Does anybody have any questions? None at all? Okay. That's all I got. Okay.
Just by the way, Jill, Paul's going right now.
Yeah, I was going to say, so actually that is a second overdose that our officers are on the way to. So it looks like it's going to be one of those nights. Also, on a lighter, more positive note, shifting away from some heavy stuff, we are also bringing back trading cards. So we are looking for sponsors to sponsor individual officers in a trading card. So if you are interested, these are going to be like little baseball playing cards. We last did them in 2000. We did them in 97, 2000. We have a collectible item from the former chief that may or may not be a special card going out. But if you are interested in sponsoring one of the cards, it can be an organization or a company. You can choose the officer or just say you would like to sponsor an officer, multiple officers, any of our civilian staff or our explorers. as well as our police canines will all have their own trading cards to hand out and at community events and as door prizes. So if anybody has questions, please absolutely shoot either us an email or give us a phone call at the non-emergency phone number. And Chief Settle, do we have any other last words for the night before we close out?
I do not, but March 18th, we expect everybody back, and expect a big crowd, and we'll honor the jurors, and we listen tonight, so we'll catch you in May 18th.
Don't worry, I got y'all. May 18th is our next meeting. It's going to be on the third Thursday instead of the fourth because the following Thursday is the Fireman's Parade. So thank you all very much for coming out. Thank you, Culpeper Media, for making us look good and sound good. Thank you, Chief, for coming back home to see us. And on that note, we are going to move to the door prizes. So